parents' meetings at schools for their children for 11 years. Starting grade 1 to grade 11, they had never time to go to their children's school and participate in parents' meetings. What does it say about? It says we, unfortunately, we're not balancing our life. We should always be able and try in our country to emulate the standards of personal life / work. We should not always live at work and die at work. We should not just have fun and like just being family-oriented only. We should try to balance, and that, in other words, we should always have the definition of it to me is bird's eye view. When you look at everyday thing, it's so important. I have to finish this paper today, but when you look at it from as if you were on the bird's eye view, not you're on the first floor of a building, but you're on the level of a helicopter flight. If you look at it kind of top down, you can see that in the 5 years perspective, whatever is so important for you today may not be that important. You don't maybe need to sacrifice so much. And so when my speech is almost over. So I've covered my personal values for you today with some examples, and I think that they somehow translate to the career values that I try to practice at work in terms of transparency, like sharing with my staff all the decisions and leadership decisions that affect staff, trying to bring everyone to work at their highest quality potential, and trying to show actual outcomes, actual results, which means it's a sign of accountability. Thank you for the time. I think I'm done. Thank you. Particularly, I want to sharpen my research skills.
Just a question regarding your values, either at work or either personal values. So, first of all, I'm not clear. Understand what's the Republic of Healthcare the center doing, but
yeah.
So at your work, how do you share this with the people? Yes. And do you keep in touch with every hospital, or you just manage on like a ministry level, and where people can get in touch with you and be inspired by your speech?
Good question. Unfortunately, the speech time was so short that I could not share much about what we do at work. So the Republican Center for Healthcare Development is a quasi-governmental organization which is wholly owned by the Minister of Health. So we totally belong to the government. However, we are in what's called on the right of economic management, which means quasi-governmental. We can provide privately paid services. We are not government employees. So what we do is, in the English terms, it's health policy think tank. The word think tank means an analytical institution that makes an analysis of the system, whatever system or area of economy it is, and we provide decision options for the Minister of Health. We do the literature review, we do the health policy analysis, and then we give decision options to the Minister of Health to say, you can choose option A, B, or C. If you choose A, it will be this, and all the outcomes, potential outcomes and risks. So what we do is we are the analytical research center for the Minister of Health. Each government branch, Minister of Economy, Minister of Health, Minister of Education, each ministry has its own institute of such kind. Because government employees do not have, first of all, good access to internet. So most websites are blocked inside government buildings. Second, they never have time to actually open up most current literature online to read the research articles, what's going on in the world. And also, they don't have the right skills. They're typically government employees who are mostly practicing their work in terms of paperwork and administrative paperwork. But they're not the people who are going to do a brainstorming. So we are, in short, we're the brain of the Minister of Health. The brain in a way that we research and analyze things for them and help them to make informed decisions. So that's the role of the Republican Center for Health Development. We're a national level institute. So we do not have branches in other parts of Kazakhstan. We work in Astana. We have a staff of about 160 people. And we manage all Minister of Health projects in terms of not just planning, but actual monitoring of the projects of ministry. The second, we do coordinate, of course, our work with the hospitals and all players in healthcare field. The players are hospitals, 16 health department centers, which is local governments, 16 local governments. We work with non-governmental associations, for example, the National Association of Family Physicians, etc. We work with all the 6 medical universities. We work with 80 nursing colleges who prepare future nurses. So we work with all kinds of different people on our work. And the other question that you asked was, how do we practice these values, such as, for example, transparency? First thing I did when I came to our organization is I found out that we do not have a long-term strategic development plan, which was expired in 2015. And when I came, I was appointed in 2017, a year ago. So the first thing we did, we developed a very comprehensive 5-year strategic development plan. And typically, a strategic plan always includes values, mission, vision, values. So we, first of all, formulated and documented our values. Second, we made sure that all staff was acquainted with those values. And also, we practice it daily. We, thanks to technology, we have a WhatsApp chat of our staff. We have a general chat where all 160 employees are there. So all decisions they know quickly at the instant. At the instance when there's something new, and we have separate chats for separate groups or departments and divisions. So, and also before we make any leadership decisions at work, we first discuss with staff. So, in terms of practicing values, we try to do it as much as we can.
So, last question.
Thank you very much. I personally know Ainur because we together studied at Indiana University, and even back then, 10 years ago, she was always there at the top of everything, doing a dive. I see that how successful you became, and I'm really proud of you. The question is that I've been following, I know like generally what Ainur is doing through her Facebook posts or whatever she's writing about the standards that she's trying to implement in the hospitals. But my question is more of a global one, I think. What do you think is, let's say, top 3 like worst policies in the system of healthcare that you would like to change, or like fundamentally what is wrong with our healthcare system?
With our healthcare?
Yes. I mean, just quick brief. I mean, I would like to hear something.
One fundamental area of what we call a red zone is tariffs. The price of healthcare services that is established by the government to reimburse healthcare providers for governmentally covered services. The tariffs, all the healthcare providers complain, are low. They don't cover actual costs. So, for example, we pay, let's say, 800 tenge for a doctor's visit for a governmentally covered service. In fact, it's even 6 times cheaper than a haircut. How can it be? A doctor has to study for so many years. It's such a highly specialized service. And so a haircut costs at least 3,000 tenge, and we pay 800 tenge for a doctor's visit. So we definitely need to quickly revise tariffs and increase them. But again, because the whole money, the budget is fixed, if we make competitive market-based tariffs, then we have to triple our budget in healthcare, which is not possible in a very short-term period. That's why we're implementing the health insurance reform. That's why we want that not just government's shoulders try to bear all the healthcare costs, but actually citizens contribute to the system, which is done in all countries. And our contribution rate is the lowest of all countries, 1%, when countries pay 10% of their salaries to healthcare system. So one area of problem is tariffs and severe underfunding of healthcare system. The second problem is infrastructure. Historically, since Soviet Union, we built separate hospital for skin diseases, a separate hospital for tuberculosis, a separate hospital for whatever else, which is not the modern model in the world. In the world, people try to have a multi-specialty hospital in one building. And so the problem with mono-specialty hospitals is you have doctors of only that specialty in that hospitals. But people, we have complex diseases. One person can have 2 or 3 or 5 diseases at a time. So that's why we are currently restructuring our infrastructure. So after 10 years, our healthcare buildings will be differently, I would say, arranged. A third problem is, I think, public mistrust into local healthcare. And there's objective reasons and there's subjective reasons as well. Public mistrust into quality. We have 15,000 Kazakhs flying to South Korea every year to get medical care. We're losing our patients to foreign countries, and that's just South Korea. Also, there's Turkey and Israel and other countries. And they're not flying out of good life. That's because they either didn't find the right quality of care here, objectively or subjectively. They perceive that their foreign care is better.
Okay, I think that's all.